I'm just floored by this. We talked for 8, 9, 10 months about one day, if we're so lucky as to be able to get an effective vaccine, not 2 vaccines or 3 vaccines, but an effective vaccine. We're going to have to work to really convince people to take it. But that was going to be the problem. I'm fascinated by the difficulty people continue to have in getting access to this vaccine. Access seems to be a bigger issue than acceptance.
Well, Ali, thank you for having me first. But the problem has many layers. There's a gap of supply, which all of us are dealing with. There's a gap of trust, and then there's a gap of access that you've alluded to. And these issues are related to the same reason why African Americans and Latinx people are being more devastated by the pandemic in the first place. We don't have access to healthcare on an equal basis. We don't have access to technology. So all the things that have led to COVID-19 disproportionately affecting the populations are being reflected now by the challenges with the vaccine. And we can't underestimate the trust issue here, that we've got to make sure we have trusted messengers, trusted organizations that are leading the way in terms of trying to get the vaccine to the people we want to get it to. And the other thing is we have to take the vaccine to these populations, not necessarily relying them coming to where the vaccines are. That has to be part of our strategy. We have to get the vaccine to the communities, because some of them just cannot make it to where the vaccines are being given. That's a major hurdle. We have to get past that.
And we're seeing it play out. The Kaiser Family Foundation has an analysis of data from 17 states. It was published just a few days ago. And it says the share of vaccinations among black people is smaller than their share of cases in all 16 reporting states and smaller than their share of deaths in 15 states. For example, in Mississippi, black people account for 15% of vaccinations compared to 38% of cases and 42% of deaths. In Delaware, 8% of vaccinations have been received by black people, while they make up nearly a quarter of cases and of deaths. Dr. Hildreth, this example, Kaiser looked at 17 states. It was the same information in almost every state.
Well, yes, and we actually saw some of that here in Tennessee. And there's no getting around the fact that when race becomes a part of any of the conversations in this country, things get complicated and very difficult. So I think we need to focus on something called the Vulnerability Index, where you account for all factors related to health disparities, where you live, your educational level, how much money you make, the kind of jobs you have. If we frame it in that context, it makes it a little less challenging to make sure the most vulnerable populations get it. Because again, we know that brown and black people are the most vulnerable, but it just appears that when we start to frame this in the context of race, it makes it very challenging for some people. So I think we have to focus on the vulnerability index. And if we do that, I think we can get this done. But you can't get around the fact that when race becomes part of the conversation, things get really more challenging. And I think that's what we're up against in this case.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.